What is the role of leadership in psychological debriefing? Have you ever wondered how leadership impacts psychological debriefing after a traumatic event? Leadership plays a vital role in the successful implementation of psychological debriefing, which is an early intervention strategy aimed at supporting individuals who may be at risk of developing post-traumatic stress disorder. This process typically involves structured group sessions led by trained facilitators, often mental health professionals, alongside peer support workers. Their primary goal is to create a safe and supportive environment for participants to discuss and process their traumatic experiences. One of the key aspects of leadership in this context is facilitation and guidance. Trained leaders ensure that discussions are constructive and validating, allowing participants to share their emotions and reactions openly. This approach aligns with cognitive models of PTSD, which highlight the importance of addressing negative thoughts and misconceptions about trauma. Another important role of leaders is to enhance group cohesion and support. By fostering a sense of connection among participants, leaders help mitigate feelings of isolation. This social support can significantly contribute to a collective sense of resilience and recovery. Leaders also provide essential information and coping strategies. They educate participants about common stress reactions and practical ways to cope with their feelings. By offering accurate information, leaders empower individuals to understand their symptoms and encourage adaptive responses, which can facilitate recovery and reduce distress. In addition to these roles, leaders are responsible for screening participants for signs of severe distress or PTSD symptoms. They play a crucial part in identifying individuals who may need further psychological assessment or intervention beyond the debriefing session. Referring participants to appropriate mental health services is an essential aspect of their responsibility. Timing and structure are also critical components of effective leadership in psychological debriefing. Leaders ensure that debriefing sessions occur within an appropriate timeframe, usually within 24 to 72 hours after the traumatic event. These sessions typically last 1 to 3 hours, maximizing the potential benefits while respecting participants' readiness to engage. However, it is essential to acknowledge the limitations of psychological debriefing. Current scientific evidence does not consistently support it as a reliable method for preventing PTSD. Some studies have shown no significant reduction in PTSD incidence or psychological distress following debriefing. In some cases, there may even be an increased risk of PTSD symptoms after such sessions. Therefore, leaders must exercise caution, emphasizing voluntary participation and integrating debriefing within a broader system of trauma-informed care and follow-up support. In summary, leadership in psychological debriefing involves skilled facilitation to support trauma survivors through validation, education, group cohesion, and referral processes. While leaders play a crucial role, they must also be aware of the limitations of psychological debriefing and ensure that it is part of a comprehensive approach to trauma care, prioritizing evidence-based practices and individualized follow-up.